Both my mother and my father had diabetes. The cause of their death was heart disease, and I just don't want to go down that path. I want to try to stay healthy.
Many people who have diabetes also have heart disease. In fact, heart disease is the leading cause of death among people with diabetes. The good news is that the steps you take to manage your diabetes go a long way to help prevent or delay heart disease. Even if you have heart disease, it's never too late to benefit from a healthier lifestyle. The exact link between diabetes and heart disease is not yet clear, but we do know that it's related to high blood glucose, high blood cholesterol and/or triglyceride levels, and high blood pressure, as well as being physically inactive and being overweight. All of these things seem to occur quite commonly in people with diabetes and are known to contribute to macrovascular disease, or disease of the large blood vessels. These large blood vessels carry blood to your heart, brain, legs, feet, arms, and hands. High blood glucose, high blood cholesterol, and high blood pressure contribute to atherosclerosis, the buildup of plaque on the inside walls of blood vessels. Atherosclerosis reduces the amount of blood that can pass through the blood vessels. Less blood means less oxygen and nutrients that can reach your body's tissues and muscles. This may cause those tissues and muscles to waste away or die. A decrease in blood flow to the heart can cause a heart attack. Not enough blood to the brain can result in a stroke. And a reduction in blood flow to the feet and legs can cause the skin to break down or die, possibly leading to amputation. However, just because you have diabetes does not mean that you will develop heart disease. The first step in preventing heart disease is to determine your own risk.
I understand that the longer I have diabetes, the greater my risk will be for heart disease, but I'd like to know, are there any other factors that figure into this?
You're absolutely right that the longer you have the diabetes, the higher the risk is of heart disease, but there are other factors.
Your risk also increases as you grow older, or if you have a family history of heart disease. But this is true for people in general, whether they have diabetes or not.
These are things I know I can't do anything about. Is there anything I can do to help myself?
Some of the risk factors you can manage or reduce are high blood glucose, high blood cholesterol, and high blood pressure. You should see your healthcare team regularly to monitor these risk factors. Have an A1C blood test at least twice a year. This test shows how well your blood glucose has been managed for the past 2 to 3 months and is done in your doctor's office or lab.
Let's talk about cholesterol now.
Cholesterol and triglycerides are fats that circulate in your body. Your body needs both, but too much of either can increase your risk of atherosclerosis, which can lead to heart disease. But all blood fats are not the same. HDL and LDL blood fats make up a large part of your total cholesterol number, and each should be checked. LDLs, or low-density lipoproteins, form the plaques that build up in your arteries. That's why it's also known as the bad cholesterol. And HDLs, or high-density lipoproteins, are often called the good cholesterol because they actually help remove LDLs from your blood. Triglycerides, another form of blood fat, can also increase plaque buildup. Your total blood cholesterol goal should be less than 200 milligrams per deciliter. Your LDL level should be less than 100, with your HDL level over 40 for men and over 50 for women. And your triglyceride level should remain under 150. Your healthcare team may also want to check the level of homocysteine in your blood. Homocysteine is a substance that in high amounts has been linked to blood vessel damage, increasing plaque buildup.
Alvin, your blood pressure is looking a lot better today.
Hypertension or high blood pressure is another risk factor you will need to monitor. Your blood pressure reading is a measure of how hard your heart has to work to pump blood through your body. If there is plaque in your arteries, your heart has to work even harder to force blood through your vessels. Your blood pressure reading is made up of two numbers. Systolic reading measures the pressure of your blood when your heart is contracting or pumping blood to other parts of your body. The diastolic reading measures the amount of pressure in your blood vessels between beats when your heart is at rest. The National Blood Pressure Education Program tells us that people with diabetes should keep their blood pressure under 130/80. In between healthcare visits, there are ways you can monitor your blood cholesterol and blood pressure levels yourself, just like you monitor your own blood glucose. You can check your cholesterol levels using a kit that can be purchased over the counter at your pharmacy. But again, make sure that your healthcare team checks your cholesterol at least once a year. Their test is more accurate and provides more complete information about the good and bad cholesterol in your blood. You can check your blood pressure at your local pharmacy, or you can purchase your own blood pressure monitor for use at home. But be sure to take your monitor with you on a healthcare team visit to ensure that you're checking properly and to check the accuracy of your monitor. Keep records of your home monitoring results and share this information with your healthcare team. In addition to monitoring your blood glucose, blood cholesterol, and blood pressure, you and your healthcare team will take a look at other heart disease risk factors, such as physical inactivity or lack of exercise, being overweight, smoking, and stress, so that you can take steps toward reducing them. A good place for you to start in protecting your heart as well as your overall health is to keep your blood glucose in your target range. Remember, the lifestyle habits that contribute to good diabetes self-care can go a long way in reducing your risk for heart disease.
But I do the same thing for the diabetes as I do for my heart. Treat one, you're treating the other.
That's because the same lifestyle choices that promote heart disease may also have caused your diabetes. To help manage your blood glucose, lower your cholesterol and blood pressure, and lose weight, you may need to improve your food choices and increase your level of activity.
Once I learned that I was at high risk for heart disease, for me the struggle was trying to re-educate myself.
Your healthcare team can help you incorporate these lifestyle changes into your life.
I don't think anybody in this world could have helped as much as they have me, because I've come a long way.
Good nutrition is key to lowering your risk for heart disease as well as to good diabetes self-care. You may want to meet with a registered dietitian to learn more about healthy eating. You can make healthy food selections wherever you're eating if you keep in mind some basic rules. Total carbohydrates count because carbohydrates raise your blood glucose. Carbohydrates high in fiber don't raise your blood glucose as fast or as high as carbohydrates low in fiber. So try replacing low-fiber carbohydrates with high-fiber carbohydrates. Some examples of high-fiber foods are whole grains, beans, lentils, fruits, and vegetables. Not only are these foods more nutritious and lower in fat, but they also tend to fill you up quicker and help you feel full longer. They can also help you lose weight and lower your blood cholesterol and blood pressure levels. Choose foods low in fat. These include fresh fruits and vegetables, lean meats like fish and skinless chicken, and dishes like pasta in a red sauce, many brown rice dishes, and salads with low-fat dressing. Your healthcare team can also give you tips on how to prepare foods without adding fat. Control your portion size. This can help you lose or maintain a healthy weight. Here's a tip for getting your portion sizes under control. Measure your foods with measuring cups. or by linking it to an everyday object. For example, 3 ounces of meat is about the size of a deck of cards. Some people with high blood pressure or other heart conditions like heart failure may need to limit their intake of sodium because too much can raise their blood pressure and put a greater strain on the heart. Work with your healthcare team to find your daily sodium limit. Being physically active is another thing you can do to benefit both your diabetes control and your heart health. Exercise helps you lose weight, manage your blood glucose, lower cholesterol and blood pressure levels, and reduce stress. It's a good idea to have a checkup before starting to make sure you don't have any medical problems that could be made worse by being active. If you have heart disease, your healthcare team may refer you to a cardiac rehab program in your area. Your exercises will probably include aerobic activity, which strengthens the heart. Some good examples are riding a bike, dancing, and swimming. Walking is another good choice because you can do it anytime, anywhere. It's important to choose activities that you enjoy so that you'll stick with your program. Your goal should be 30 minutes or more of aerobic activity 3 to 5 times a week. If you haven't been active and find 30 minutes too difficult, break it down into 3 10-minute sessions. When you're ready, make your workouts longer and do them more often. And remember, always begin with a warm-up activity and end with a cool-down period. An important step you can take is to stop smoking. If you smoke, your risk of heart disease is much, much higher than a non-smoker's. Cigarette smoke makes your heart pump faster, narrows your blood vessels, increasing your blood pressure, and robs your cells of oxygen. Over time, this may damage blood vessels and add to plaque buildup. Smoke may also cause your vessels to spasm, which can lead to angina or heart attack. Quitting smoking can help you feel better and have more energy, and over time can reduce your risk of heart disease. Your healthcare team can suggest ways to help break the addiction. Nicotine patches, gums, inhalers, and nasal sprays, as well as oral medications, can help you satisfy the craving for nicotine without lighting up. You may also need the support of your friends and family in this effort.
Man, would you not smoke, please?
I can do without it for you.
Changing lifestyle habits can be difficult, and this challenge can actually lead to another risk factor: stress. Stress may be harmful to your diabetes control as well as to your heart health. The physical effects of stress may include an increase in blood pressure and hormonal levels, which damage blood vessels. Emotionally, stress can get in the way of keeping healthy habits. For example, you may eat more to comfort yourself, lose your will to exercise, or even return to other harmful habits, which can lead to a cycle that is very hard to break. If making lifestyle changes is causing you to feel weighed down, your healthcare team can help. Work with them to set realistic goals. Reaching a goal will give you a sense of success so that you can feel ready and maybe even eager to take the next step. Of course, you can't get rid of all the stress in your life, but you can manage it.
And I especially like to work outdoors. I almost think of it as therapeutic.
Set aside time each day to relax. Your diabetes care team can help you choose relaxation methods that work for you.
Oh, I love fishing. I'm relaxed. My troubles are all gone, especially when I catch them.
Hobbies can help you refocus on what's important.
Everyone has stress in their life, and one of the ways that I relieve stress is by working with my Major Corps. I find it very rewarding working with young people. Then I don't have to think about me. I don't have to think about my diabetes, so it relaxes me.
Managing stress, as well as eating well, exercising, and quitting smoking, are very important steps you can take to reduce your risk of heart disease. But if these lifestyle changes aren't enough, your healthcare team may prescribe medications. Organize your medications in a way that reminds you to take them as prescribed. Have all of your prescriptions filled at the same pharmacy, so that they can keep track of your medications and inform you of which ones may be harmful when taken with another medication. Make a complete list of the medications for yourself and share it with each member of your healthcare team.
I need to know the symptoms of heart disease because I know I'm at high risk.
Symptoms of heart disease that are often ignored include shortness of breath and weakness or tiredness after doing everyday activities. If you notice any of these symptoms, contact your healthcare team. Symptoms of a heart attack may include chest pain, called angina, chest pressure, neck, jaw, or arm pain, often accompanied by sweating, nausea, or vomiting. If you have had diabetes for more than 5 years, you may have a complication that keeps you from feeling the pain that may signal a heart attack. So it's important for you to be aware of all the symptoms. At the first sign of a heart attack, call for emergency medical help or have someone drive you to the emergency room and chew 2 aspirin. Research tells us that doing this may lessen the severity of your heart attack and save your life. As a person with diabetes, you need to be ever aware of your increased risk of heart disease. This means monitoring your risk factors, especially blood glucose, blood cholesterol, and blood pressure, and taking the necessary steps to reduce these risks by making healthy food choices, being physically active, not smoking, and managing stress.
How do they say? Health is my habit. And I want to live that style. I want to live that way because, after all, without health, there's no life.
And I know that the end result of my not controlling my diabetes, again, is going to lead to some serious heart problems. So it's something that I have to control. And perhaps I can live a long, healthy life.